The thyroid gland is located in the front of the neck, just below the thyroid cartilage known as Adam's apple. It is composed of 2 lobes on either side of the windpipe. Despite its small size, the thyroid gland has an important task. Thyroid gland produces hormones, which are important for the growth and energy metabolism of the body. The production of thyroid hormones is controlled by another hormone called the thyroid-stimulating hormone, or TSH. TSH is secreted by the pituitary gland in response to the stimulation from the hypothalamus in the brain. The thyroid needs iodine out of nutrition in order to produce thyroid hormone. There are 2 primary thyroid hormones produced by the thyroid gland: thyroxine, also called T4, and triiodothyronine, which is also known as T3. The numbers 3 and 4 found in their names indicate the number of iodine atoms in each hormone. T4 is inactive and is converted by the body into its active form, T3. Thyroid hormone is transported by the blood to the tissues of the body, where it acts. Thyroid hormone plays a key role in all processes of the body, specifically in the growth, development, and energy utilization. Deficiency of thyroid hormone causes delay in these processes, while excessive thyroid hormone can lead to a malignant acceleration of such body processes.
Hi everyone, today our lecture number is 12 and our topic is drug affecting on thyroid gland. So let's start our lecture. First of all, we should know about thyroid gland. Thyroid gland is an endocrine gland in the neck consisting of 2 connected lobes. The lower 2/3 of the lobes are connected by a thin band of tissues called thyroid isthmus. The thyroid gland is a vital hormone gland. It plays a major role in the metabolism, growth, and development of the body. It helps to regulate many body functions by constantly releasing a steady amount of thyroid hormones into the bloodstream. If the body needs more energy in certain situations, for instance, if it is growing or cold or during pregnancy, the thyroid gland produces more hormones. This organ medical term glandular thyroidea is found at the front of the neck under the voice box. It is butterfly shaped. The 2 side lobes lie against and around the windpipe and are connected at the front by a narrow strip of tissue. The thyroid weighs between 20 and 60 grams on average, and the outer capsule is connected by the voice box muscle and many important vessels and nerves. There is loose connective tissue between the inner and outer capsule, so the thyroid can move and change its position when we swallow. Next, below the larynx there is a thyroid gland. One part is right thyroid gland and the other is left thyroid gland. The thyroid tissue itself consists of a lot of small individual lobules that are enclosed in thin layers of connective tissue. These lobules contain a great number of small vesicles called follicles, which store thyroid hormones in the form of little droplets. In the picture you can see small vesicle on the outside, and they are known as thyroid follicle, and in the inside there is coloring part, pinkish coloring part. This is colloid, which is mean as follicle content with a precursor of the thyroid hormone. Next, you can see also the picture, and every know about this. First of all, hypothalamus produces thyrotropin releasing hormone, which synthesizes releasing hormone, and releasing hormone acts on anterior pituitary. Anterior pituitary synthesizes thyroid stimulating hormone, and thyroid stimulating hormone acts on triiodothyronine, thyroxine, and calcitonin. Next, hypothalamus produces thyroid releasing hormone, which acts on anterior pituitary, and anterior pituitary synthesizes thyroid stimulating hormone. Thyroid stimulating hormone synthesizes thyroid globin and iodine. Thyroid peroxidase synthesize thyroid globin and iodine, and thyroid globin and iodine both combinedly synthesize thyroxine and triiodothyronine. Thyroid uses salts which comes gained from food by sodium iodide. It transport iodine to colloid by corn transporter. Next is the formulas of tetrahydrothyrronine and triiodothyronine. Thyroid peroxidase synthesize thyroid globin, and thyroid globin synthesize tyrosine plus iodine, which synthesize thyroxine and triiodothyronine. 2 molecules of tyrosine and 4 molecules of iodine produces tetraiodothyronine, and 1 molecule of alanine. And 2 molecules of tyrosine and 3 molecules of iodine, when combined, they form a structure triiodothyronine and 1 molecule of alanine. Thyroid peroxidase transfer hormones into the bloodstream. The thyroid hormones regulate the body's metabolic rate, controlling heart, muscle, digestive function, brain development, and bone maintenance. It corrects function depends on a good supply of iodine from the diet. Goiter. An enlarged thyroid gland due to any cause is called goiter. For the gland to be palpable, it must be at least 40 grams. A patient with goiter may be thyroid, hyperthyroid, or hypothyroid. Next one is hypothyroidism, in which low thyroid hormone occurs, also called underactive thyroid, and low thyroid or hypothyroidism is a disorder of the endocrine system. Symptoms of an underactive thyroid: tiredness, being sensitive to cold, weight gain, constipation, depression, slow movement and thoughts, muscles aches and weakness, and muscle cramps. Standard treatment for hypothyroidism is levothyroxine. Next is cretinism, congenital hypothyroidism, underactivity of the thyroid gland at birth, which results in growth retardation, development delay, and other abnormal features. Cretinism can be due to deficiency of iodine in the mother's diet during pregnancy. Next one is hyperthyroidism, in which high amount of thyroid hormone occurs. Overactive thyroid occurs when the thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate body's metabolism, causing unintentionally weight loss and a rapid or irregular heartbeat. Where several treatments are available for hypothyroidism. Symptoms of an overactive thyroid: nervousness and anxiety, irritability, mood swings, difficulty sleeping, and persistent tiredness and weakness, sensitivity to heat, swelling in the neck from an enlarged thyroid gland, and irregular and or unusual fast heart rate, and twitching or trembling. Graves' disease is an immune system disorder that results in the overproduction of thyroid hormones, and this is a very common cause of hyperthyroidism disease. Thyroid peroxidase may enter the bloodstream, and the immune system perceives as a foreign substance and antibodies. Anti-thyroperoxidase antibody. Standard treatment for Hashimoto disease is levothyroxine and the synthetic form of thyroxine. However, extracts are available that contain thyroid hormone derived from the thyroid glands of pigs. These products, amorthyroid, for example, contain both levothyroxine and triiodothyronine. Here is the prescription of potassium iodide. Internal dose is 100 and 200 microgram and half-life is 24 hours. Common side effects of potassium iodide include allergic reactions, skin rashes such as hives, swelling of various parts of the body such as the face, lips, tongue, throat, hand, feet, fever with the joint pain, trouble breathing and speaking or swelling, wheezing or shortness of breath. Next is levothyroxine. Brand name is Livoxil and Synthroid and Unithroid. Internal dose is from 25 microgram to 300 microgram, and parental dose is 100 microgram per 5 milliliter. Half-life is 6 to 7 days. The more common side effects of levothyroxine can include increased appetite, weight loss, heat sensitivity, excessive sweating, headache, hypersensitivity, nervousness, and anxiety. Next is methimazole. Internal dosage tablet 5 mg and 10 mg, and half-life is 5 to 6 hours. Propylthiouracil, and internal dose is 50 mg tablet and half-life is 1 to 2 hours. Common side effect may include nausea, vomiting, upset stomach, headache, dizziness, drowsiness, numbness or tingly feeling, and rash, itching, skin discoloration, muscle or joint pain, hair loss or decreased sense of taste. Here is the mechanism of action. Next, after testing in laboratory, you got this results of analysis of patient. For example, results of analysis of patient is, for example, years of birth is 1988. Here's in description: thyroid stimulating hormone. Results is 6.84, which is higher than normal, and normal is 0.4 to 4.0. Free thyroxine is 2.79, which is lower than normal. Normal is 4.4 and to 11.6. Units of measure is microgram per deciliter. Total triiodothyronine is 126 and normal is 84 to 172. This analysis carried out, patient got hypothyroidism disease, and you prescribe this medicine, levothyroxine iodine. Next report is, for example, year of birth is 1964. Thyroid stimulating hormone is 0.24, which is lower than normal. Adult is 0.4 to 4.0. Free thyroxine is 20.79, which is higher than normal. Normal is 4.4 to 11.6. Total triiodothyronine is 126 and normal is 84 to 172. According to this, patient got hyperthyroidism in this increased thyroid hormone, and you prescribe this medicine, methimazole tablets 10 mg. In the next, for example, year of birth is 2000 and thyroid stimulating is 5.88, which is higher than normal. Normal is 0.4 to 4.0, and total thyroxine is 3.24, which is lower than normal. Normal is 4.4 to 11.6, and free thyroxine is 1.16, which is normal, and normal is 0.89 to 1.76. Thyroid peroxidase antibody is 271, which is higher, and this, according to this analysis, patient got Hashimoto's thyroiditis, and you prescribe amothyroid tablets to a patient. Here is the way of prescription. You can write first patient name, then address, prescription box, then signature. You can write and date. And thank you.